Good afternoon and hello. My name is Renee D. Waring and I am the founder of Uniquely and Wonderfully Made Ministries. The title of my today's presentation is Mental Hospitals Mental Illness Part 3 R Waring. My presentations can be found on LinkedIn under Renee D. Waring, on Facebook under Waring Communications, LLC, on Twitter under @ReneeWaring, and on YouTube under smallcase In the 1890s, economics affected psychiatric hospitals in order to reduce the cost for running them. Local governments began to avoid the cost of caring for elderly residents in almshouses or public hospitals by redefining the illness of elderly patients as that of senility, which was classified as a psychiatric problem. These elderly men and women were sent to state-run asylums. The numbers of these patients grew exponentially, well beyond the available capacity and the willingness of states to provide the financial resources necessary to provide acceptable care. However, the therapeutic considerations also played a role. The promise of moral treatment confronted the reality that many patients, particularly if they experienced some form of dementia, either could not or did not respond when placed in asylum environment. The medical superintendents of asylums desired that patients would receive moral treatment. A significant effort was made to practice moral treatment. The nurses' training schools were first established in American general hospitals in the 1860s and 1870s. The trained nurses had already proved to be critical in the success of these particular hospitals. The superintendents hoped that nurses would have the same effect in their psychiatric institutions. Rather than following the accepted European model, where nurses who were trained in psychiatric institutions were given an exam that was believed to be comparable to the exam given to students of general hospitals. As a result, psychiatric nurses were given a different title other than registered nurse, which nurses of general hospitals received. Instead, contrary to the European model, supervisors wanted to have psychiatric nurses to take the same exam as nursing students in general hospitals and receive the same title as registered nurses. The leaders of the American Nurses Association fought hard to prevent this, arguing that those trained in asylums lacked the necessary medical, surgical, and obstetrics experience common to the general hospital trained nurses. The association could not prevail politically. It would be decades before the American nursing leaders had the necessary social and political weight to ensure that all training schools, regardless of the site of their training, had comparable clinical and classroom experiences. It is at present hard to assess the impact of nurses' training schools on actual patients in psychiatric institutions. In the larger public institutions, nursing students work only particular wards. They have substantial impact on the care of patients in much smaller and private psychiatric hospitals. The most enduring contribution of nurses was opening the practice of professional nursing to men. Training schools and asylums actively welcomed men, unlike those in general hospitals. Male students found places either in schools that also accepted women or in separate schools formed just for them. This ends my presentation for today. My next presentation will air on the fourth Thursday or Friday of this month. Please view my video and ask someone to view it too. My presentations can be found on LinkedIn under Renee D. Waring, on Facebook under Waring Communications, LLC, on Twitter at Renee Waring, and on YouTube, Warring. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Waring, and I am the Warrior Warring.